Well, thank you for joining me for this educational video. We're looking at Medicare, made simple. Now, as described, this is an educational video and not a sales presentation. So we've had many people tell us over the years that they really appreciated it and our consultative style. Here's what we're going to be covering: who is eligible and how to enroll, original Medicare Parts A and B, Medicare Supplement insurance, Medicare Part D or prescription drug plan, Medicare Advantage or Part C, how to choose a plan that's right for you, and finally, the different enrollment periods and penalties. Well, hi, my name is John DeShaw, and I'm a financial advisor with Solera Asset Managers and Insurance Agency. We're located in Roseville, California. We're a local, independent financial services office and really focus on helping those eligible for Medicare, primarily in Central and Northern California. But we can help you no matter what state you live in the U.S. Well, we've completed the annual American Healthcare Insurance Professionals certification and are certified to offer both Medicare Advantage and Medicare Supplement plans. We're licensed, contracted, and appointed with multiple national and regional carriers of Medicare plans, so we can offer you several solution choices. Now, this presentation is for educational purposes only. We do not offer every plan available in your area, and any information we provide is limited to those plans that we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all your plan options. We must inform you that we are not a part of the federal government, nor are we connected directly with the Center for Medicare Services. In this brief Medicare Made Simple discussion, we won't be able to cover all aspects of Medicare or all plan options for every situation, but we will keep this to a summary of what most people need to know. Now, you can check out our resources at johndeshaw.com and see if there's other topics there that might be a help for you. So to cover the highlights of what Medicare provides, let's start with eligibility and enrollment. Well, what is Medicare? Medicare is health insurance for older and disabled American citizens and other eligible individuals. It's funded in part by federal payroll taxes paid by employees and employers. Medicare is individual insurance. Each person is covered as an individual. Well, who can get Medicare? First, Medicare is for U.S. citizens and for legal residents living in the United States for at least the last 5 years. You must be age 65 or have a qualifying disability and be receiving disability benefits for the last 24 months. Well, how do you enroll? If you have worked and paid taxes for 40 quarters or 10 years, you qualify for Medicare Part A at no monthly premium or charge for the insurance. You will be automatically enrolled and receive your card in the mail. But if you're not currently receiving Social Security benefits, you will need to sign up for Part B. Now, there also is a monthly charge for Part B, and we'll cover that in a moment. Enrolling in Medicare is a two-step process. Step one is to enroll in the original Medicare program, which consists of Part A and B, and is provided by the federal government. Here you decide if you need more coverage. Option two is to choose a Medicare Advantage plan instead. You get drug coverage with either option. Well, first up is original Medicare. This is the core coverage provided by the federal government. Now, it has two parts. Part A helps pay for hospital stays and inpatient care. Part B helps pay for doctor visits and outpatient care. Starting with Part A helps to pay. Now, you'll notice I'm emphasizing helps to pay. It helps to pay operating room and recovery room expenses, drug supplies, labs, and x-rays used in the hospital as an inpatient. Note the critical word I mentioned was helps pay for hospital stays. You can't use the word covers hospital stays. It would sound like it's a blanket and everything is included and you don't have any expenses. But that's not just the case. You cannot be denied Part A coverage. You can go to any qualified healthcare provider in the country who participates in the Medicare program and is accepting Medicare payments, and you will be accepted. Here are the basic costs for Part A. The premium is $0 for most people, as we discussed, but you will pay a deductible in 2025 of $1,676 if you're admitted to the hospital. Now, this will cover you for the first 60 days in one benefit period. But if you stay longer than 60 days, you'll pay a $419 copay for each day. Then, after 90 days, you will pay $838 per day for what's called the 60 lifetime reserve days. After that period, then, you will have 100% of all the expenses, whatever those expenses are. And as it says at the bottom, Part A coverage and costs are based on benefit periods. Well, a benefit period begins the day you're admitted to the hospital, and it ends when you've been out for 60 days in a row. So if you have multiple events in the same year, separated by 60 days, you will pay that $1,676 benefit period deductible multiple times in 1 year. It's not likely, but technically it could happen. Well, that's Part A. Let's take a look at the second part, Part B, medical insurance. Now, Part B helps pay for doctor services and outpatient care. Think of this as you're primarily helping with the cost of your medical care outside the hospital. Like Part A, a strong feature is that you cannot be denied Part B coverage. You can go to any facility in the country, any doctor in the country that accepts Medicare for payment, and you will be able to go to that facility or physician. Part B helps to pay for doctor visits, labs, blood tests, x-rays, physical therapy, other outpatient services. I'm just highlighting a few of them. Regarding the costs for Part B, the 2025 premium is $185 per month for most people, but it may be more if your income 2 years earlier was above $106,000 for individuals or above $212,000 for couples. Now, if your modified adjustment income from 2 years earlier, which is 2023 this year, is above that minimum, your premium will be higher in 2025. You can see each of the brackets on this slide. This is what's called the income-related monthly adjustment amount, otherwise known as IRMA. Now, you're required to have Part B if you are 65 and don't have health coverage through a current employer or a spouse's health plan. The 2025 annual deductible is $257 for Part B. After that deductible is met, in other words, you've paid the $257, that might be your first doctor's appointment, lab tests, outpatient x-rays, you are responsible for 20% of all the costs. Now, note in red, just like Part A, there is no annual out-of-pocket maximum. There's no limit to your financial risk. So we've gone over original Medicare, Parts A and B, what they help to pay. Now let's look at what it does not cover. Original Medicare does not cover prescription drugs, which can be a big expense as we age. Other non-covered services include routine physicals, dental, vision, hearing care, glasses, contacts, hearing aids. Long-term care is not covered. Custodial care, which includes bathing, eating, dressing, the activities of daily living, of what's called as ADLs, does not cover those. Care received outside the United States, except in very limited circumstances. Well, now that we've looked at original Medicare Part A and B, step 2 is to decide if you need or if you want additional coverage available through private insurance companies. You have 2 options for more coverage. Option 1 in red is to add a Medicare Supplement insurance plan and or a Part D prescription drug plan to original Medicare. Option 2 in blue on the right is to choose a Medicare Advantage plan, or what's also known as Part C. The Medicare Advantage plans available in our area include the Part D drug plan coverage as well as additional benefits. Now, these private plans options were created to give you more choices and the ability to fill in the gaps not covered by original Medicare. Well, let's look at option number 1, adding a Medicare Supplement insurance plan and a Part D prescription drug plan to original Medicare. Now, Medicare Supplement insurance, or what's known as Medigap, is offered by private insurance companies. It supplements Medicare. So it is not a Medicare plan by itself, but limits the out-of-pocket costs that come with traditional Medicare. A Med Sup, as it has become known, can only be used with original Medicare, not with a Medicare Advantage plan. you must be enrolled in Medicare Part A and B to be eligible for Medicare Supplement plan. Medicare Supplement insurance plans are standardized by the federal government. Each plan is labeled with an alphabet letter. Every plan with the same letter offers the same benefits, no matter what state it's offered in or by what company is offering it. The level of coverage varies by plan. One plan covers all of your Medicare deductibles, co-payments, and co-insurance, while others leave some of those costs for you to pay on your own. Medicare Supplement plans provide nationwide coverage. The main benefit of Medicare Supplement plans is that they allow you to see any doctor anywhere in the country that accepts Medicare and is a way to manage your healthcare costs through your monthly premium charges, which generally result in lower charges when you receive medical services. Regarding the cost or the premium, they set their own plan premiums. This is not regulated by Medicare. Plans that provide more coverage have higher premiums. Premiums vary for the exact same coverage. So pay attention. We've helped people get the same coverage for significantly less dollars per month simply by comparing plans and their prices of different insurance companies. Premiums may change from year to year. They often do. Enroll during your Medicare Supplement open enrollment period, or you may be denied coverage or be charged more based on your health. Now this chart shows all the MedSup plans offered today listed across the top, and the benefits they cover listed down the left side. As you can see, the level of coverage varies. There are standardized plans that cover all your Medicare deductibles, co-payments, and co-insurance, while others have some costs for you to pay on your own. For example, if you're new to Medicare in 2025, the most comprehensive plan you could buy is Plan G, right here down the center. Plan G from one insurance company has exactly the same benefits as Plan G from all other insurance companies. Now this means that you can shop based solely on price. I know some of you are looking at this chart and saying, well, what about Plan F way over on the right? It seems to offer 100%, which is a higher amount in all the boxes than Plan G. Well, unfortunately, Plan F is only available to individuals who turn 65 prior to January 1st, 2020. Now, but to give you an idea, a Plan G currently for a 65-year-old newly enrolled in Medicare can be anywhere from around $138 a month to $240 for the first year you are new to Medicare for the exact same coverage, a difference of over $100 per month. But call us and we can give you a quote on what the range is on pricing and plans in your area. Well, here at Solera, we take price comparisons to a whole different level. We not only look at the listed price, but also we look at a company's standardized rate increases. So this means how they raise premiums as you age historically. Yes, all MedSup plans do get more expensive as you age. You become more of a health risk. You're more expensive to insure. In general, MedSup plans have higher premiums than Medicare Advantage plans, but the costs on the back end are very predictable. For example, if you enroll in a Medicare Plan G, the only medical expense you will have is your Part B annual deductible, which is $257 currently this year in 2025. So you will pay the first $257 of your care costs, but after that, all other costs are covered other than a portion of any foreign travel emergency, which no plan fully covers. You will have all your copays, all your out-of-pocket expenses taken care of by the insurance company. You simply manage your monthly premium, and that really is a way to look at it as what your healthcare cost expenses are for the coming year, other than drug plans, which we'll talk about. So that is the first part of option one, adding a Medicare supplement plan to original Medicare. Now let's look at what also is needed and required by Medicare if you don't have a prescription drug plan through a current employer, a spouse's plan, a government plan, or a railroad plan. Medicare Part D prescription drug plans. An easy way to think about is D for drugs. Remember, drugs are generally not covered by a original Medicare. Definitely when you're outside of a hospital experience as an outpatient, drugs are not included. You can get drug coverage in two different ways: through a separate standalone Part D drug plan or through a Medicare Advantage plan, which we'll discuss in a moment. Part D drug plans are offered by private insurance companies. You must be enrolled in Part A or Part B to be eligible for Part D plan. The premium costs of Part D plans vary quite a bit, anywhere from $1.80 a month this year to over $183 per month. By just checking out Medicare.gov, you can see where those prices lie in your county. Part D may charge a premium penalty if you don't sign up when you're first eligible, unless you qualify for what's known as an SEP, a special enrollment period. The maximum deductible this year is $590. Not all plans have a deductible, but generally the ones with the lowest monthly premium do have that deductible. Plans may vary. They may charge quite a bit for prescriptions. The copays might be quite a bit different between plans. You need to be able to check that out, and we can help you with that. Insurance companies have a list of covered medications on each plan that's called a formulary. Now, these drugs are usually broken down into 5 tiers. Some companies have 6 tiers. When choosing a plan, it's important to make sure that the drugs you take are on the plan's list of covered drugs and to understand the costs, which can vary from plan to plan. Now, Tier 1 are going to be your preferred generic drugs, the least expensive. Many times it's a zero copay or just $1 or $2. Then comes generic, then Tier 3 are preferred name brands, then name brands, then specialty drugs. And some companies offer a Tier 6. Not many, but some of them do. And as you would assume, typically the preferred generics also have the lowest copays. The specialty medications will have the highest copays for that drug. As an example of how plans commonly work, a Tier 1 preferred generic might be $0 or $1. It might be a $0 copay or a $5 copay for Tier 2 non-preferred generics. Tier 3 might be $25 to $47 amongst a few of the companies that I checked out. Preferred name brands for Tier 4, $100 or 40% coinsurance for non-preferred brand, and 25 to 31% instead of $1 range would be the coinsurance for Tier 5 specialty medications. The copay and coinsurance amount listed for that tier is what you'll pay for your medication in that tier when you pick up your drugs at the pharmacy. Now, commonly prescribed drugs are included according to federal standards, but not all expensive drugs are very attractively priced amongst all companies, so you'll have to shop for that, and we can help you with that. Like Part B, your premium monthly for Part D is adjusted for your income. So if your reported income 2 years earlier, so this year would be for 2023, if it was larger than $106,000 for a single or over $212,000 for couples, you could be charged more than the plan premium. You can appeal your premium if your income is significantly lower now than it was 2 years ago. For instance, if you just retired and are now living off significantly less than you were while working, there's a standard form for this. It's called the IRMA Appeals Form. You can find it on the Social Security website, or you can just contact us and we can email you one. Let's take a minute here to look at what's taken place in a change with the coverage stages of Part D, since this is the most confusing part for most people. Now, in 2024, there were 4 stages of Part D. The deductible stage, where you just paid a deductible. The initial coverage stage, where you would pay a small copay. And then the coverage gap, or what's called the donut hole. And then the catastrophic coverage. Each stage has a dollar limit set by Medicare. That marks when you exit that stage and enter the next. The limits shown here can change from year to year. The Inflation Reduction Act was enacted in 2022. It is the most significant change to prescription drug financing since the creation of Medicare Part D. It includes a lowered cap on Medicare Part D cost sharing and penalties for pharmaceutical manufacturers that raise the prices faster than inflation. Now, though the catastrophic level of out-of-pocket drug expenses for many seniors will be lowered, experts expect that the cost will be passed on to Medicare plan providers, in other words, insurance companies. And as a result, the monthly premium for standalone Part drug plans went up significantly in 2025. You'll notice that on this chart, there is no longer the coverage gap donut hole. Now, instead of this $8,000 limit for drug costs out of pocket, it went down to $2,000 across the board. It's honestly only helped a handful of my clients. Most of them just simply have a much higher premium. But you'll notice after a $2,000 out-of-pocket expense, now the catastrophic coverage stage also then drops to totally zero for all drugs after that, where last year and before it was $8,000 before it went down to zero for the consumer to start paying. All right, well, now we're going to look at option 2 in blue, Part C or Medicare Advantage. Part C is Medicare Advantage. It's an alternative to original Medicare and offers another way to get your benefits. Some plans offer provider networks that you need to use. Plans are offered by private insurance companies, approved by Medicare, and vary depending on where you live. Coverage and costs above the standards set by Medicare vary from plan to plan. You must be enrolled in both Part A and B to be eligible for a Part C plan. By law, Medicare Advantage plans must provide all benefits that original Medicare Part A and B provides. Most Medicare Advantage plans in our area include Part D prescription drug coverage and offer additional benefits, including coverage for dental, vision, or hearing care, as well as wellness and fitness programs. The result is an all-in-one plan similar to what you may be used to while you had a plan through your employer. Many Medicare Advantage plans offer extra benefits, like these that are something over and above original Medicare. With an Advantage plan, you pay a low monthly premium, currently anywhere from $0 per month to over $140 per month, depending on where you live. This includes the drug plan premium. These plan premiums are so modest because the plans are regulated by the Center for Medicare Services. And after you select a provider, Medicare is allegedly forwarding close to $900 each month to that carrier to administer the health care plan for your medical needs instead of Medicare. That allows them to provide other plan features that benefit your overall health, like dental, hearing, gym memberships, even over-the-counter health benefits are often available monthly at no cost to you. You continue to pay your Part B premium to Medicare. Some plans have deductibles and others don't. Many plans charge copays for doctor visits, prescription drugs, etc. Amounts vary from plan to plan. Plans may set coinsurance terms for certain services. Although the annual out-of-pocket maximum for 2025 is $9,350, many plans, and I would say most plans, set much lower limits than that. Well, let's go back to the graphic we looked at earlier. Step 1 is to enroll in the original Medicare program, Part A and Part B, provided by the federal government. Step 2, you decide if you want more coverage than original Medicare provides. If you do, you have two options. Option 1, add a Medicare Supplement plan and a Part D drug plan, or option 2 is to choose a Medicare Advantage plan instead. Let's think about the choice in terms of coverage, cost, and convenience. Coverage. Medicare Supplement insurance plans help pay for care from providers nationwide. Medicare Advantage plans generally have provider networks in a set geographic area, but not always. Costs. Both options help manage costs, but in very different ways. With a supplement plan, you may pay higher premiums than with an Advantage plan, but other costs are lower. With an Advantage plan, you pay copays, but the monthly premiums will be low, and you are protected by an annual out-of-pocket maximum. Convenience. People who opt for a supplement plan also buy a Part D drug plan, along with their original Medicare. That's 3 different plans. Many people just don't like having 3 different insurance cards to carry with them, or to have to deal with 3 different sources when it comes to billing issues. With an Advantage plan, there's usually just 1 card. Well, let's look at enrollment periods. Most people first enroll in Medicare during their initial enrollment period, or what's known as an IEP. Your IEP is 7 months long. It includes your 65th birthday month, plus the 3 months before and the 3 months after. If your birthday is on the first of the month, then you uniquely have an enrollment period that begins and ends 1 month earlier. If you qualify for Medicare due to disability, then your IEP includes your 25th month of receiving benefits, the 3 months before and the 3 months after. You may refuse or delay Part B enrollment and take Part A only if you have employer or another coverage. You also may join a Medicare Advantage or Part D drug plan during your initial enrollment period if you're eligible. Now, Medicare Supplement open enrollment period, you are not subject to medical underwriting only for 6 months after you enroll in Part B at age 65 or older. You can still apply for a supplement plan after that 6-month window, but you may be denied coverage or charged more based on your health history, which you will have to report as you enroll. Medicare provides a special enrollment period for people who work and have employer coverage past age 65. You have 8 months to enroll in Part B and Part A if you haven't already done so. Now, you may enroll in Medicare Advantage or a prescription drug plan, but only within the 2-month period. Now, Part A and Part B and Part D charge enrollment periods penalties if you are late. The Part D penalty doesn't apply to many people, but the Part B penalty is an additional 10% of the premium for each full 12-month period you could have had Part B but didn't have it. The Part D penalty is an additional 1% of the current average plan premium for each month that you're late. Changing your coverage. You can change your coverage choices during Medicare's annual enrollment period, which is October 15th through December 7th every year. The new coverage goes into effect on January 1st. During this time, you can join, you can switch, or you can drop a Medicare Advantage plan or a prescription drug plan. If you drop the Advantage plan, your coverage goes back to traditional Medicare A and B only. If you're enrolled in a Medicare Advantage plan from January 1st through March 31st, you can change your coverage just one time to either a different Medicare Advantage plan or go back to original Medicare. Lastly, if you have what's called a qualifying event, a good example would be if you move to a different county, let's say. You have 2 months after the month of the event to make plan changes in most cases. Help with Medicare costs. If you need financial assistance, it is available. A good place to start is with the State Health Insurance Assistance Program, known as the SHIP office. There's also what's called extra help available for Part D low-income subsidy. There's a phone number there you can call. Also, you can contact that website. For Medicaid, in our state, Medi-Cal provides health care coverage for people and families with limited incomes. So that's a source for you also to go for financial help. Those who don't qualify for what's known as extra help but are of limited means may qualify for help by appealing to the State Pharmaceutical Assistance Program for the cost of their prescription drugs. Your healthcare needs vary greatly based on your personal circumstances. We do these videos for a couple of reasons. First and foremost, it's most important to us to be a resource to you to educate and to clear up any confusion you may have around the whole project or whole subject of Medicare. Secondly, we like to be your guides on this journey for years and years to come on an annual basis. So what's next? This is a lot of information. Now, we'd like to help you find the right fit for you. We're really good at this, and we're also very passionate about helping people. So when you're ready, the next step would be for you to contact us for a one-on-one Medicare strategy session to discover the right plans available for you. You might be thinking, well, how are you compensated? Well, we're proudly an independent financial services and insurance broker service in Roseville, California. We represent most of all the most popular providers of Medicare plans, so we don't have an obligation to any particular company or plan. This allows us to do the right thing for you and be compensated by them, not by you. And the compensation is identical because it's regulated by Medicare Services on behalf of all those insurance companies, whichever one you select. Also, California law dictates that all companies compensate licensed agents equally for the same plan type. So our focus is helping you select the right plan for you. It's good for you to know that the plan you choose charges you the same whether you do it on your own or you have an independent licensed insurance broker like us guide you through the process of comparing, selecting, and enrolling in a plan that suits you. If you have questions or would like to schedule a virtual chat with us, here is our contact information. We've helped many people like you through this difficult decision-making process, and we'd love to help you. And we appreciate you sharing this time with us. You can also go to the website at johndeshaw.com to view more videos there or content from our topic pages. Thank you for your time.